Good evening. I'm Dr. Wong here, a clinical oncologist from IKN. So today actually is my honor to sit here and to share with you all my experience about the myths and facts about cancers. So we know that 4th of February is the World Cancer Days. So in Malaysia, 1 out of 10 males and 1 out of 9 females has a risk of developing cancers in their whole lifetime. The most common cancers for male in Malaysia actually is colorectal cancer, lung cancer, and prostate cancer. But for female, it will be a breast cancer, colorectal, as well as the cervical cancers. So in a daily clinical practice, we will be asked a lot of questions about cancers. First most common one is, can cancer be contagious? If I have a cancer, can my cancer be spread to my family members? And I have a kids or pregnant lady in my house. The answer is, cancer is not contagious, means it will not spread from one person to another person. But some cancer causes can be due to the viruses and bacteria. Like we know that human papilloma virus can cause cervical cancer, anal cancer, as well as actually some of the head and neck cancer. Hepatitis B and hepatitis C will increase the chance of developing liver cancer. And also we know that H. pylori infection in the stomach has a higher chance to develop stomach cancer. Cancer can caused by all these viruses and bacteria. Bear in mind, these viruses and bacteria can spread from one person to different route of administration, but this cancer that caused by the bacteria and viruses cannot be spread from one person to another person. So family members and patients not to be worried that the cancer can spread from one person to another person. The other things is, they will commonly ask is, my close family members has cancer now. So will this cancer means that actually in my lifetime, sure I will develop cancer? The answer is no. Actually, most of the cause of the cancer can be prevented if we have a simple changes to have a healthy lifestyle. Somehow we try to don't smoking, not to smoke, and we try to reduce our alcohol intake. We try to have a healthy diet. We try to balance up our weight, and then we have the exercise. All these things we can take actually to reduce our risk of cancers. And also sometimes we can do a routine checkup, or we have a breast cells examinations. This is all this we can do actually to reduce the chance of developing cancers. And if you do have a genetic, the risk of a genetic to cause the cancer, actually you can talk to your doctors or healthcare team how to do the prevention and how to do a routine checkup to have an early detection of cancers. And the other question that I always been asked is, should I stop taking sugar if I have a cancer now? If I'm taking sugar now, can the cancer cells be spread and grow rapidly in our body? The answer is, actually until now, there is no conclusive or strong evidence to show that taking sugar can increase the chance of the cancer cell to grow more rapidly in our bodies. The cells in our body, we have a healthy cells as well as we have a cancer cells. And all these cells actually we need sugar to grow and functions. So when we talk about stopping taking sugar at all, which will limit the growth of the cancer cell, actually there's no proof on that. But of course, this is not means that actually we can take a diet with high sugar, because diet with high sugar can cause weight gain, can cause obesity, as well as can cause diabetes, which can also harm our own health and also have an increased risk of cancers. And the other things we always found among our patients is they come to see the doctors when the disease is too advanced. So most of them, they will feel frightened, they will feel scared to see doctors when they feel that something is wrong in their body. Like if they feel a breast lump, they will keep it for quite some time before they can come to see the doctors. And actually this is quite sad actually, because when the disease become more advanced and become stage 3 or stage 4, the chance of us to cure the disease will be very dismal, means it's very low for us actually to cure the cancers as compared those we come with the early stage. So I will urge that those family members or those we see our friends who have like symptoms or signs of cancers, like they have a lump, an abnormal growing mole in their bodies, they have a weight loss without any reason, they have a headache, or they have an abnormal per-vaginal bleeding, they should come to see the doctors as soon as possible to find out what is the diagnosis. Remember, the early diagnosis actually can cure the cancers. And we know that on the 4th of February, with the World Cancer Days, the theme actually is I am and I will. And together, all our action matters. Mean actually, we are not fighting the cancer alone. We have a healthcare team as one of us, as a family members and friends. We have to all sit together and we have to work together actually to achieve a better life, a healthier life or work without cancers. So the other things I would like to talk about, of course, is the treatments of cancers. I would urge that everyone, please don't scared to come to talk about cancer treatment when we talk about chemotherapy and we talk about radiotherapy. With the advances of research going on and advances of treatment, so a lot of these treatment can come with a very less side effects and also very effective for us to control the cancers. So at this moment, I will urge all the public as well as all the healthcare team, we should all sit together and work together to fight the cancer. Thank you.